Hello, my name is Dominique, and this is a nurse case management presentation on a female admitted to the ICU for diabetic ketoacidosis. The presenters include myself, Yael, Victor, Brenda, Nicole, and Gabrielle.
So let's first discuss a little bit about the patient and her chronic illness. A little bit of background on our patient again is she's 45-year-old female. She's a single mother with 4 children, ages 5 to 21. Her financial status is low income and she has medical insurance. She works full-time as a waitress. However, her job does not provide benefits. She has a medical history of type 2 diabetes and hypertension, both diagnosed at age 38. A little bit about her lifestyle is she has poor eating habits. She is non-compliant with her medications. She does not exercise, and she does not visit her physician routinely. However, she does perform her ADLs independently and is able to take care of herself and her children. Why she's being admitted to the hospital is again for symptoms of diabetic ketoacidosis. She presented to the ER with fatigue, shortness of breath, and abdominal pain. Her blood sugar in the ER was 442, and she had stated that she was experiencing increased thirst, urination, and hunger for 2 days prior. She was then admitted to the ICU for administration of IV insulin. And now as the case manager, we come introduce ourselves and we start to assess any discharge needs she may have. Let's discuss clinical judgment comparing self-care capacity with chronic illness and treatment demands. The patient assessment that I gathered is that she's able to perform her ADLs independently, especially prior to admission. During her admission, she expressed fatigue. She did not want to ambulate with physical therapy due to her abdominal pain. She did not express any physical assistance needed post-discharge, and she does state that she has a blood glucose monitor at home that was provided to her 7 years ago. She did say that she ran out of strips to perform regular monitoring. She states that she does not have the time or the money to upkeep with medication costs and also with the strips for her blood glucose monitor. My clinical judgment is she needs a lot of education regarding blood glucose monitoring, insulin administration, dietary changes, and physical activity. She needs referral to diabetic counseling. If there is not one that is provided in the hospital, then there are free programs that are available, especially if programs are not covered by her insurance. She'll also need referral to social services for financial programs to help with cost. Maybe there's programs that can help her pay for her medications or for her upkeep with her strips for blood glucose monitoring. And then if we're sending her home with strips to use a blood glucose monitor, we want to make sure that she even knows how to use her blood glucose monitor. It was provided to her 7 years ago. We don't know when's the last time she used it and if she knows how to use it properly. So this will be an opportunity to find out what she knows and what education we need to further provide. Priority patient issues for discharge planning. So in other words, what does the patient need? Does she need durable medical equipment, DME, which could be blood glucose monitoring devices and related supplies? As we learned, she needs strips for her blood glucose monitor. So we need to find out what device she has and if we can order some strips for her. We also need to assess if she needs any home health services. Does she need a nurse to go into the home to administer insulin for her or do her blood glucose monitoring? If not, is she able to provide it for herself? We need to see if she needs any skilled nursing facility placement or rehabilitation referrals in case her condition declines and the doctor and the case manager, such as me or my group members, we assess that she needs further care, then we can refer to a skilled nursing facility. Again, referral to social services, and then diabetic education programs or possible outpatient physical therapy if needed. So all these things we're going to keep in mind as we follow her and see if there's anything specific that we can do to help with her discharge planning. Clinical judgment about where a patient can be discharged. Her expected discharge disposition is to be discharged home with blood glucose monitoring and supplies. Our discharge plan is to provide her with a follow-up appointment with her primary care physician and to provide her with community resources for diabetic education. And if there's any other needs that we assess or the patient expresses, we can also include that in our discharge planning for her.
There are several priority nurse case management strategies that are appropriate for our patient. At the patient level, the patient will need to learn how to check her blood sugars regularly and self-administer the proper doses of insulin. These two patient-level strategies for our patient will help keep her sugars under control, prevent complications of diabetes, and avoid the need for hospitalization for DKA. According to the American Diabetes Association 2018, sugar control for diabetic patients can help prevent many complications, which may include but are not limited to kidney disease, eye complications, and foot complications. Our patient has already been diagnosed with hypertension, a possible complication secondary to her diabetes, so it is imperative that we prevent additional complications from occurring. The patient will need to change her diet and increase physical activity. Exercise can help increase insulin sensitivity and promote glucose uptake by the muscles. What our patient consumes will directly affect her disease. For example, foods high on the glycemic index will increase her blood sugars more than items that are low on the glycemic index. Again, these patient-level strategies will help our patient control her blood sugars. One priority system-level strategy for our patient is to connect her to financial programs, which may be offered by the healthcare facility and state or federal government. Our patient has expressed to us that one of the reasons she is non-compliant with medications or blood sugar checks is because she does not have the financial means to do so. Bridging this gap can help her achieve the strategies mentioned earlier under the patient level. A second system-level strategy is to provide access to the health system's online patient portals to increase the ease of managing her disease. This topic will be discussed further in the next slide. Connecting the patient to education programs provided by the healthcare system or governments can help our patient learn critical information that she needs to take care of herself and her disease.
Hello, my name is Yael Leanda, and I'm going to discuss intervention for the patient-level nurse case management strategy. First of all, we need to help patient assess her current self-management behaviors and help her identify and adapt to new behaviors as needed. Guide patient learn and actively perform self-care activities, provide patient adherence treatment interventions, provide patient education interventions, help patient identify and or create a psychosocial network, and assist patients to simplify regimens. It is a fact that DKA may be caused by infections or drug interactions, but the most frequent cause is insulin omission, as is the case of our patient. Higher at risk for recurrent DKA are younger people with higher levels of social economic deprivation, familial issues, and higher level of depression linked to an acute deterioration in coping strategies. Basically, we must know the causes for why our patient is omitting to actively perform self-care activities and adherence practices before implementing an intervention plan. To help patients self-manage their chronic illnesses and complex symptoms, we must follow intervention strategies that include developing coping skills, patient empowerment, self-monitoring, managing medications, implementing an exercise and diet plan. Important to remember that successful nurse case management involves collaboration with other healthcare professionals that help implement patient-level intervention strategy, including medical staff, nursing staff, dietitian, diabetic nurse care specialists, social services, physical therapy, and occupational therapy. Next, I want to discuss interventions for the system-level strategy. We need to implement financial assessment of patients' income to provide all possible government-assisted financial aid for inpatient coverage and outpatient coverage. Assist patient how to navigate the healthcare system to accommodate her busy schedule. Coordinate, facilitate, maximize the safety and welfare of the patient. Powell and Tahan 2010 describes assessed deficits of services and resources are compensated by case management. filling healthcare gaps, reduce any duplication through coordination of services, or allocate resources, which requires knowledge of public and private organizations. In assisting patient to navigate the healthcare system to accommodate her busy schedule, it's important for patient to take advantage of new technologies to assist her in getting fast, efficient service from her outpatient services. Included are her pharmacy and doctor's office. One technology patient will be urged to use is a patient portal, which goes beyond providing her with a window into which she could view her health data. She could access secure messaging between her and healthcare providers. She may access online appointment scheduling and schedule lab workup before her doctor's appointment. MD and patient having the opportunity to view and assess patient labs. So if, for example, the target is looking at her hemoglobin A1C levels, if she has no illnesses that need to be physically assessed by her doctor, they may have a telephone consult to review her A1C, compare with previous, review her current self-care practices, and make self-management practices and medication adjustments as necessary. Patient may also complete all prescription transactions online and receive her medications by mail if she has no time to pick up her medications. Much of the growth of information health technology is due to the Centers for Medicare and Medicaid Services meaningful use requirements. Part of the CMS's protocol for meaningful use of the EHR was therefore tied to patient portal use. Through the understanding of all that patient portals can do, providers can leverage these tools to help boost patient engagement and keep serving their clients' needs outside of the four walls of a doctor's office or hospital. Research shows that when patients are able to see their own health data, they gain ownership of their own wellness and are better prepared to interact with their providers about their care.
Hi everyone, my name is Brenda Dion. I will be talking about the utilization review, utilization management for patient in this presentation. So according to Powell and Tahan, the goal of utilization review is to use the healthcare resources to provide the highest quality of patient care in the most cost-effective and efficient setting. So during the utilization review, the insurance companies, in this case medical, will look through our patient medical records for evidence of the appropriate low-cost healthcare. Then the medical then compares our patient's record to those of other patients with the same condition, in this case, TKI. So finally, medical will then review and possibly revise TKA treatment guidelines and criteria to ensure that the provided care is adequate and medically current for the condition. So nurse case managers review the utilization of services to make sure that the patient's insurance will cover for this service. So in other words, the nurse case manager will be reviewing all the services that were provided to our patient during the treatment of the DKA. That could include the intravenous insulin, the stents, or the treatment in the ICU, then the treatment in another floors. They also review all the medical notes to make sure that all is appropriate for the patient to be in the hospital. And then once they compare these and they see that it's appropriate, then the insurance probably will cover for all these costs.
Quality and safety issues. When a patient leaves the hospital, it is important to make sure that they have the right resources to help them post-discharge. Patients need to have optimal care, to have high quality of care, and have minimal safety risks, with encouragement to seek help with any concerns. Specifically for our patient, it is important she has access to her prescriptions with a list of pharmacies she would be covered under her insurance. She will also be provided with a list of resources, websites, and phone numbers for her and her family to call if they have any questions or concerns with her health, symptom management, and medications. The end result is for the patient to feel more comfortable with caring for herself so she doesn't have to come back to the hospital for lack of resources. This ensures that she has safe and quality care.
Nurse case manager effectiveness at patient level. The patient needs to be able to recognize when she is suffering from signs and symptoms of hypoglycemia or hyperglycemia so that she can take appropriate action and avoid getting critically ill. She also needs to be able to check her blood glucose levels as prescribed by using her glucometer. It is important that she maintain a low hemoglobin A1C as a sign of good diabetes management and also for better health. She needs to start being compliant with medications for better control of her diabetes condition. This will reflect on her hemoglobin A1C. She will have better control signs and symptoms of either hypoglycemia or hyperglycemia, and she will have better overall health and possibly avoid complications of the disease. Nurse case manager effectiveness at system level. She will be transitioning from acute care setting to a lower level of care, which would be with her primary care physician and possibly a specialist and endocrinologist. Community resources need to be identified so they can assist her with any diabetic supplies that she may be missing. She did mention time and cost, so we need to find out exactly what Medi-Cal is not covering and get her the appropriate resources by collaborating with the social worker. She needs to have high participation during any teaching for diabetes management. Building good rapport and a trusting relationship will produce that environment that will encourage her to participate. So that relationship is very important between the nurse case manager and the patient. A good relationship is key. The nurse case manager will also advocate for the patient and collaborate with the whole team. With the patient's admitting physician, any specialty consultants like endocrinology, dietary, and the primary care nurse. It is really important to have clear communication and collaboration with every member of the team.
This concludes our presentation, and this is our list of references. Thank you.